Hey everyone, this is Sanskriti Varshanay from Molecular Detectives. Here, I share information about cancer, from the molecular level to things in our daily lives and environment that affect cancer development. My goal is to explain the intriguing science behind cancer in meaningful episodes that will help you understand preventative measures, cancer signs and treatment methods, and ultimately for you to make evidence-based decisions to minimize the risk of cancer. Thank you for joining me in today's episode, and I hope you enjoy. Music heals. Have you ever heard that before? While music may not have the ability to cure cancer or diseases, at least not yet, the effects of music therapy have been studied a lot, and researchers have found that music therapy can benefit cancer patients mentally. In this episode, I'll talk about what music therapy is, how it's beneficial, what a typical session looks like, the history behind music therapy, and some testimonials and personal stories. This episode is going to be an interesting one, so stay tuned. What music therapy entails may seem obvious, but it's not just listening to someone practice an instrument or learning how to play one. Music therapy is about collaboration between patients and a professional music therapist to help patients open up, reduce anxiety, and even improve cognition. According to the cancer research website based in the UK, patients may listen to music, dance to music if they can, sing, play music on simple instruments, write and talk about song lyrics, and even go deeper into the music, like adding imagery. The goal of music therapy is for music therapists to create personalized plans to lift up patients emotionally, socially, and cognitively so that they can go through their treatments with more ease. So, how is music therapy beneficial to patients? In general, music helps calm us down. I know that in our daily lives, many people pull out their AirPods and headphones when they may be stressed out or want to focus. But when used in a hospital setting as therapy with the guidance of a music therapist, it can do more. According to a Cochrane review in 2021, music therapy can help with anxiety, depression, hope, pain, and fatigue in adults with cancer. Although more research is needed, lots of other studies come to similar conclusions. Music helps. But how is it helpful for cancer treatment? Cancer patients don't have an easy time going to cancer treatment. Not only are the treatments painful, but they also cause a variety of symptoms like fatigue, nausea, and vomiting. Cancer treatments can make one lose their hair, which may bring shame, and once people find out someone has cancer, they don't really treat them the same way. Sure, they may care about the patient's wellness and do helpful things for them, but once a person gets cancer, they're seen more as patients and less as people. Others may feel bad for the cancer patients, making them feel pity for the patients, and this can greatly lower one's mood and self-esteem, as patients may think that there's no hope for them, or that they're always going to be seen as sick people. This can also make cancer patients not want to be social around others or meet up with friends and family. Also, according to the American Cancer Society, patients going through chemotherapy may have difficulty remembering things, focusing on and finishing tasks, or learning something new. Cancer not only brings upon malfunctioning cells in the body, but it also brings emotional pain and trouble with social and cognitive needs. Music therapy in cancer care can help patients with self-awareness, which may boost their morale and make it easier for them to accept their cancer diagnosis. It also helps with self-expression, which can make it easier for the patient to discuss their feelings and emotions with others. How exactly does music therapy do this? Well, music activates areas of the brain that are involved in emotion, memory, and even language, and it can trigger dopamine to be released, which is a neurotransmitter that makes you feel good. This can reduce anxiety and stress, and musical rhythms can help regulate heart rate and respiratory rate. An important benefit of music therapy is that it distracts from the pain and can even decrease the need for pain medications. In fact, on the Memorial Sloan Kettering Cancer Center website, a patient said that music therapy was better than an antidepressant and with fewer side effects. They also said that if they could get music therapy every day, they would only need half of the amount of drugs they usually get. Slow and relaxing music can also decrease cortisol levels, which is a hormone that increases stress. For patients who have a cognitive decline in cancer treatments, especially in chemotherapy, this phenomenon is called having a chemo brain. Music therapy helps a lot with coordination, attention, and memory issues. Many studies have been done on this. For example, in the University of Texas at Austin, researchers led a study with women who had breast cancer, and they received chemotherapy and had cognitive issues because of it. The women were divided into two groups, and one group listened to classical music like Beethoven and Tchaikovsky every day for 12 minutes, and the other group practiced an Indian meditation called Kirtan Kriya, which basically counts as music therapy because it's like a singing exercise. They did this for 12 minutes a day as well. Both groups participated for 8 weeks, and at the end, both groups noticed improvements in cognitive function, such as having better memory, focus, and being better able to solve problems. And a bonus is that the group that listened to classical music felt less stressed and fatigued. All of these benefits happened without chemical medications that have their own side effects. Music therapy has no side effects, and it is able to do all of this, which is really fascinating, and it also shows a lot about music's natural effectiveness. More research is needed, but all studies done so far have been pointing in the same direction. Also, according to the survey of United States music therapists, the majority of music therapists work in oncology, which is the cancer field. This shows how impactful music can be for cancer patients. Next, we'll talk about what a typical session of music therapy looks like. Music therapy sessions usually last 30 to 60 minutes long. In the beginning, the musical therapist will talk to the patient about how they're feeling and how their treatment is going. They'll also talk about goals for the session, which can be reducing stress or getting distracted from pain. The core of the session depends on the patient and their preferences, but the therapist may play music, live or recorded, and the patient will listen to it and talk with the therapist. The patient may also join the therapist by singing along or dancing to the music. The music can also be paired with guided breathing or guided imagination. Next, the patient might play the instruments themselves, and it'll usually be something simple like drums or a small keyboard. Patients may also compose music or do some songwriting with the therapists, which boosts creativity and even cognition. But most patients participate in songwriting with the goal of expressing their emotions or having something to give to their loved ones. This is really common in palliative care, which mainly focuses on improving a patient's quality of life during an illness. Finally, the therapist may have a small meditation session with the patient while playing music, which really helps with reducing stress and pain. Cancer patients may have music therapy regularly for weeks or months, and some may even continue after their cancer treatment because of the positive soothing and calming effects. I know I've already spent a lot of time discussing the benefits of music therapy, and I talked about some studies, but now I want to take some time to share some patients' music therapy journeys and how it affected them. We'll start with someone named Cynthia Mallorin. Cynthia was a professional DJ and writer from New York City, and she was diagnosed with breast cancer at the age of 39. She already faced anxiety before getting diagnosed, and after learning of her diagnosis, it was even harder for her to cope with her anxiety. Cynthia would go through surgery to remove her breasts, but before that, she was given Herceptin, a medicine that would prevent her cancer cells from growing and spreading. However, it turned out that she was allergic to it. So when she asked her doctor what to do, her doctor told her 2 words that would change the track of her treatment and mindset. She said to be happy. This surprised Cynthia, but then she realized the importance of being happy. She said, I realized if I can manage my stress and my emotions, that I would have the best chances of surviving even though I was taken off of treatment. She joined a music therapy study at the Memorial Sloan Kettering Cancer Center, where she sometimes wrote lyrics or hummed along while listening to songs. Cynthia expressed having greatly benefited from the therapy and said that music was the ultimate way for her to heal. Currently, she has been in remission for a decade, and she says that whenever she's feeling down, she hums to herself and experiences great benefit from it. Let me quickly introduce you to another patient, Robin Hesseling. Robin was a patient going through treatment for stage 4 metastatic breast cancer, and she participated in a study where she had piano lessons and she received very comprehensive instructions. She described always looking forward to her lessons and being able to have something enjoyable, even if it was only for 30 minutes or an hour. She said that they have a very positive effect on her. And as a musician myself, I can also testify that music is very enjoyable, even though I don't have cancer. Whenever I play the piano and violin, the music touches me in a way that calms me down and also helps me focus. I am a really good student in school, and music may be part of the reason why. Now that we've talked about some patients and their stories, I want to cover one last question. Can music actually make cancer go away? Unfortunately, the answer is no, because music is not like a medication that can damage DNA growth in cancer cells or stop enzymes from making proteins that are needed in cancer cells. Instead, music has the effect of calming the brain, which helps patients mentally. Even having a positive mindset actually does a lot in treating cancer. Being in a bad mood or experiencing negative emotions because of cancer puts more stress on the body, which can make cancer treatments less effective. So, music can't actually cure cancer, but it can help the body fight it and improve your mental state. To add one final claim from a study, Dr. Liu performed a study with other researchers to see how effective music therapy is compared to cognitive behavioral therapy, which is the most common type of therapy for anxiety. He determined that music therapy is just as effective as CBT, and that it has long-lasting benefits for patients' anxieties during their cancer journeys. Music therapy continues to be researched, and I can't wait to see more of the potential it can bring in the future. This was an information-packed episode. Music therapy may have been something you weren't expecting to hear about, but I hope you enjoyed listening to its benefits in general and for cancer patients and the patient stories. Music therapy doesn't have a physical structure for the body, but it brings mental benefits to the brain and can help, from anxiety all the way to cognition. Even if you don't have cancer, music is a great activity to participate in, whether it's playing an instrument, composing, humming, or even listening. It's also never too late to start. Whenever you have some time, sing along to your favorite song, try learning to play something on an instrument, or listen to some classical music while reading a book. I'm sure you'll enjoy the time you spend with music and will want to do it again. Alright, that's it for this episode. Thank you for listening and stay tuned for the next episode.